The locations of interest are growing by the day, with over 140 places now listed. With the highly contagious Delta strain, health officials are expecting the number of confirmed cases to grow. Joining us now for more is epidemiologist Michael Baker. Good morning, Michael. What is your... If you were advising the government at the moment, how far would you extend that level 4 for the rest of the country?
Ryan. Look, this is to be expected. We now know the boundaries of this outbreak, which is very helpful. We know approximately when it started, where it was focused. And of course, we don't know the outer boundaries. We don't know the extent to which infected people have travelled to the South Island. And I think the government is, as we'd expect, being very cautious about how to manage this. And essentially,
it looks like we might have lost.
This intense lockdown means that everyone is essentially quarantining at home. So that's very valuable.
Yeah, absolutely. So do you think that they will need to go much further in terms of lockdowns? Let's talk for Auckland and Coromandel in particular. Given the number of cases and the fact that we're coming to understand the chain of transmission, do you think this is going to be more than a month? People are wanting to know. And I know it's hard, but people are wanting to know. Give us a rough idea of what you think, Michael.
I wouldn't speculate much out beyond another week extension, potentially, across the whole country. I think the uncertain area really will be outside Auckland and the Coromandel. The difficulty, as we know, is the geographically targeted lockdown has been quite hard to manage in the past. There are ways you could do this, but I think that's one of the challenges. I'm certain we will see that, we'll go down the alert levels outside Auckland, the Coromandel, hopefully as soon as it's clear that there are not cases outside Auckland and that region. So that's, I guess, what we're looking for.
Yeah, which is why that testing's so important. How concerning is it that we've got 2 colleges, according to those particular colleges in Auckland, that 2 colleges have been added to the locations of interest, that there are positive cases at those schools?
Well, we know that infected people went to a whole lot of indoor environments that are very high risk. Not just schools, but also churches, nightclubs, bars, restaurants. So we can expect to see quite a few more cases, I think, in the next couple of days. So that's inevitable. And I think the schools are part of that. But again, the good news is that because everyone is quarantining at home, all of these lines of transmission will stamp themselves out. I think one of the big concerns with this outbreak that's different from ones we've had before is very much in young people, and many of them don't have many symptoms. They feel that perhaps they're not overly concerned perhaps about the outbreak for some of them. And of course, they have these huge social networks and they want to get out. And you only look at the places of interest, includes all the sort of places that young people like to go to. So one of the key things, I think, is all of us who've got teenage children and have young adults in our families, is to explain to them why they are part of this outbreak, why it really matters that they change their behaviour for the next 2 or 3 or 4 weeks, because that's how we're going to get it under control.
Michael, just a question, because obviously this comes through MIQ. It's made it through MIQ somehow. Why don't we vaccinate, or at least give people their first jab the minute they enter an MIQ facility?
Yeah, I think it's a very good suggestion. And given the move to vaccinate everyone in New Zealand, I think we should look at that. I think that's a really good idea.
Are you surprised that 40% of our police officers are vaccinated? These are the guys that are out there right now policing the whole thing, and only 40% of them have got a jab.
I agree. This focus on essential workers needs to happen because that's one of the... I mean, there are some weak points in our otherwise very effective lockdown. I mean, it's one of the most intense anywhere in the world, but hopefully it's short. And we only do it once, and we do it well. But yes, you're right. I mean, this is one of the loopholes with the system, is that at least 10% of the population are in this essential workforce. So they should be vaccinated and they should be wearing masks. Well, hopefully they're wearing masks all the time.